Today, I'm joined by Andre Bethia, who is Policy Advisor for Corrections at the Bureau of Justice Assistance at the U.S. Department of Justice. Previously, Andre served as the Director for Program Operations and Policy at the New York City Department of Correction and at the New York City Police Department. I'm also joined by Allison Upton, Project Manager, and Sarah Wurzberg, Deputy Program Director in the Behavioral Health Division here at the Council of State Governments Justice Center. To give you an overview of today's webinar, first we will do introductions to the Bureau of Justice Assistance, the Justice Center, and the National Reentry Resource Center. Then we will provide more information on the CSAMI grant program, and then we'll talk about the Planning and Implementation Guide and the Technical Assistance process. And at the end, we'll have time for questions and answers. At any time during the webinar, you can use the chat box function at the lower right-hand corner of your screen to enter questions. We'll keep a running list of questions, and at the end, we'll do our best to get through as many questions as we can. And we can follow up by email for questions that were not addressed on the webinar today. And now I will turn things over to Andre Bethia, who will talk a little bit more about the Bureau of Justice Assistance.
Good afternoon. Thank you, Mark. Good afternoon and congratulations to the entire cohort of fiscal year 18 grantees. My name is Andre Bethia, and I am the Policy Advisor for the Second Chance Act, Improving Reentry for Adults with Co-occurring Substance Abuse and Mental Illness, or CSAMI for short, in the Policy Office at the Bureau of Justice Assistance, or BJA. Lots of acronyms. At BJA, our mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Specifically, BJA provides funding to support law enforcement, combat violent and drug-related crime, and combat victimization. Through the development and implementation of policy, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. The Second Chance Act, or SCA, has supported over $300 million in reentry services since it was passed in 2008. SCA supports state, local, and tribal governments and nonprofit organizations in their work to reduce recidivism and improve outcomes for people returning from incarceration. We are excited to work with you to plan and implement the 2018 CSAMI grants. The grant program focused on how to change your system in order to better address people with co-occurring substance abuse and mental illnesses. I will now turn things back to Mark to provide some information on the National Reentry Resource Center.
Thanks, Andre. Now I'm going to give some background information on the Council of State Governments Justice Center and the National Reentry Resource Center, or NRRC for short. The Justice Center is a national nonprofit, nonpartisan organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. And on this slide, you can see some examples of our publications in issue areas such as justice reinvestment, behavioral health, school discipline, and reentry and employment. The Justice Center operates the National Reentry Resource Center, NRRC, in partnership with the Bureau of Justice Assistance. And since 2009, the NRRC has provided technical assistance to more than 600 grantees. There are several functions of the NRRC: to deliver technical assistance and training for Second Chance Act grantees, advance the knowledge base of the reentry field, promote what works in reentry and the successes of grantees, facilitate peer networks and information exchange, and provide information for people returning to communities and their families. And here you can see a screenshot of the National Reentry Resource Center's website. And I believe we are sending a link to the website as well right now through the webinar. And now I will turn things back over to Andre, who will talk more about the Second Chance Act CSAMI grant program.
Thanks, Mark. Excuse me. Since 2010, over $61 million has been awarded to states, counties, territories, and tribal nations for CSAMI. In 2018, there was $9 million in award money to 13 grantees. There have been over 100 awards across the country for the CSAMI grant program. This has included 47 counties, 25 states, and this category includes the District of Columbia and Guam, and 6 tribal grantees. Again, congratulations to the 13 grantees in the new 2018 cohort. I would like to welcome all of the new grantees. On the state side, we have the Judiciary of Guam, the Louisiana Department of Public Safety and Corrections, and the Mississippi Department of Corrections. Under our local Category 2, we have Bexar County Hospital District, the Board of County Commissioners of Hillsborough County, Florida, City of Kansas City, Missouri, Clark County, Washington, County of Durham, North Carolina, County of Sonoma, California, Jefferson County, Colorado. And under our Tribal Nations category, we have Cook Inlet Tribal Council Incorporated, Confederate Salish and Kootenai tribes, and the Lower Brule Sioux tribe. BJA and the NRRC are looking forward to getting to know you better over the next 36 months. This is your second part of your orientation process. Hopefully you were able to attend the Bureau of Justice Assistance Second Chance Act orientation webinar on last week, Thursday, October 25th. Today is the fiscal year 18 specific. Fiscal year 18 Second Chance Act, Improving Reentry for Adults with Co-occurring Substance Abuse and Mental Illness, otherwise known as CSAMI, Grantee Orientation Webinar. There will also be a performance measurement tool webinar on Wednesday, November 21st from 1 to 2 p.m. Eastern for all CSAMI grantees. You will have already received an email from your technical assistance provider, who is either Mark Stovall or Allison Upton. Please work with them to set up your first call. You will be having monthly calls with your technical assistance provider moving forward. They look forward to working with you. I would like to explain the people you will be in communication with over your grant award period. As I mentioned earlier, I work at the Bureau of Justice Assistance. I work in the policy office. You will also have communication with Jennifer Lewis from the BJA program office. She will be the point of contact for your budget and grant adjustments. Jennifer spoke on the Second Chance Act orientation webinar last week. The National Reentry Resource Center, or NRRC, provides training and technical assistance. As I mentioned, your technical assistance, or for short, TA provider, will have monthly calls with you, and for some grantees, the TA provider will be able to do site visits. There will also be distance learning opportunities for you to connect with other grantees in your cohort. Lastly, Booz Allen Hamilton oversees the Performance Measurement Tool, or the PMT. The PMT is where you will input the data you collect for the grant in order to answer questions. As I mentioned, there will be a PMT co-occurring grantee webinar later this month. The goal of these grants are to improve access and delivery of co-occurring substance abuse and mental illness services when people are incarcerated and as they re-enter the community. This includes coordination among correction, substance abuse and mental health treatment providers, correctional health, probation, and parole, and other service providers involved in the reentry process. Through this grant program, we expect grantees to use collaborative, comprehensive case management plans that address criminogenic risk, substance abuse, and mental health needs. We will further explain the collaborative, comprehensive case plan process that was developed specifically for the CSAMI grantees a few slides from now. In addition to the collaborative, comprehensive case management, grantees will provide standardized screening and assessment for everyone in the correctional facility. This will include pre- and post-release programming to address criminogenic risk and needs, substance abuse, and mental illness. The grant has undergone some significant changes this year to ensure that grantees are focused on providing services to all those who are eligible, like the standardized screening and assessment that I just mentioned, case management protocols, and pre- and post-release cognitive behavioral interventions, and CSAMI treatment services. The intention was to shift the program to be more systems-focused. We really see this grant as a great opportunity to have discussions about how to improve your system for people with co-occurring substance abuse and mental illness through incarceration and reentry. For the objectives and deliverables, the screening and assessment process for mental illness and substance abuse will happen when people enter the correctional facilities. This could be at booking, intake, or classifications, for example. For the people who screen positive for substance abuse and mental illness, there will be assessments provided prior to the person's release from the correctional facility. While the person with co-occurring substance abuse and mental illness is in the correctional facility, and when they re-enter the community, they will receive substance abuse and mental illness treatment and cognitive behavioral interventions to address criminogenic risk and needs. The criminogenic risk assessment and substance abuse and mental illness assessments will all be used to create a collaborative, comprehensive case plan. This will include a coordinated effort by the key partners to plan for the person's reentry. Additionally, grantees will work to create a performance measurement plan that outlines who is responsible for data collection, input, and analysis. This will help grantees as you move to implementation to make sure you are tracking your successes and progress. I will now turn it over to Mark to further discuss the Collaborative Comprehensive Case Plan web-based tool.
Thanks, Andre. Now I'm going to provide an overview of the Collaborative Comprehensive Case Plans web tool, which is designed to help practitioners in the field develop and implement case plans that balance behavioral health needs and criminogenic needs, and to work effectively with all entities involved in someone's reentry and recovery. And specifically, the tool will help CSAMI grantees meet one of the grant requirements, as Andre just discussed, which is to develop collaborative comprehensive case plans that incorporate criminogenic risk, substance use, and mental health needs. So what you're looking at on this slide is a snapshot of the Collaborative Comprehensive Case Plans web tool. The tool was launched in October of last year, 2017, and it was created to serve as a one-stop shop for information on developing and implementing case plans that balance risk and behavioral health needs, which is something that traditionally has been a challenge to the field. This tool builds upon a publication that the Justice Center produced called Adults with Behavioral Health Needs Under Correctional Supervision, which was designed to be a tool to help systems plan for matching and prioritizing supervision and treatment services for different groups of individuals in order to reduce recidivism and promote recovery. The framework shows how to identify groups of people for supervision and programming based on their criminogenic risk, substance use need, and mental health need. So ideally, the process would start with administering a criminogenic risk assessment, which would identify people who are low, medium, and high criminogenic risk. Then a substance use disorder assessment to determine presence and severity of the disorder. And then an assessment for mental illness to determine presence and severity. And after you complete these 3 assessments, you identify 8 groups of individuals. Group 1 requires a minimal amount of supervision and services. Groups 2 through 4 are not likely to recidivate because of their low criminogenic risk, but they do have behavioral health needs that should be addressed through treatment. And people in these groups might be good candidates for diversion programs. Groups 6 through 8 should be the target of most reentry programs for people with behavioral health needs. They have the highest need for supervision and cognitive programming, as well as treatment for behavioral health needs. So this framework tells you what to do at a conceptual level in terms of matching resources to the level of criminogenic risk and behavioral health needs. With the Collaborative Comprehensive Case Plans webpage, we wanted to make this tool very implementation focused. And so what you're looking at here, this color wheel, it visually represents the relationship between the lead case planner and other entities involved in someone's reentry and recovery, And on the webpage, there are examples of how different agencies can take the lead and how they can coordinate with other agencies and entities in the case planning process. And the 3 most common types of lead case planners that we see are correctional facilities, community-based behavioral health treatment providers, and community supervision agencies. And when you click on each one of those different portions of the color wheel, you can see examples of information that the lead case planner should provide to the entities and what the lead case planner should receive from those entities at the same time. And the web tool also has snapshots of 3 grantee programs under the CSAMI grant track for adults with co-occurring substance use and mental illness. The 3 programs are Franklin County Sheriff's Office in Franklin County, Massachusetts, San Joaquin County, California Probation Department, and Bridgeway Recovery Services in Marion County, Oregon. And so each snapshot has basic information about the jurisdiction and the program, and then the snapshot focuses on 3 key areas for collaborative comprehensive case plans, which are interagency collaboration and information sharing, staff training, and screening and assessment. And we also have webinars available featuring individuals from each of these 3 grantee programs, and the webinars are archived on the Collaborative Comprehensive Case Plans website. And finally, the web tool has a list of 10 priorities and components for case planning, which you can see here. And each one of these bars is expandable, so if you click on the plus sign, you can read a little bit more information about each component and priority, and also see links to resources for more information. So now I'm going to turn things over to my colleague Allison Upton to talk about the Planning and Implementation Guide and the Technical Assistance Process.
Thanks, Mark. Hello, everyone. Very excited to be on the webinar today with you, and want to just start by highlighting a few key points about the Planning and Implementation Guide process. So completion and submission of the Planning and Implementation Guide is a grant requirement, and it's really a key piece of the activity that you're going to be working on early in your grant cycle, along with the support of your TA provider. So the guide, the Planning and Implementation Guide itself, is a written tool used during the planning phase that helps teams plan really in depth all of the key facets of their grant program. And so you can see here some examples. A completed Planning and Implementation Guide contains a lot of different information, but here are some examples for you just to notice today. So for example, a completed guide will include all of the details, the description of the plan that your grant program is going to use for standardized screening and assessment, and also your specific plan on how your team will be integrating the collaborative comprehensive case plan processing into your work with your specific participants. A completed guide will also include, in a lot of detail, all of the data collection and research and evaluation processes that you're planning, including what types of solution and hypotheses are you going to be testing and looking at, what are your intended outcomes for your grant program and all of your evaluation metrics, including the research base for your proposed strategies, and all of your data points in your ongoing monitoring and analysis and assessment of your overall project impact. So So again, completion and submission of the Planning and Implementation Guide is a grant requirement, and just want to again highlight some key budgetary issues and time frame issues for you, because these are common questions that that grantees ask. So grantees will receive intensive technical assistance and will be allowed to access up to $150,000 of the total grant award in order to complete and submit the required planning and implementation guide, which will be provided to you all by the BJA technical assistance provider, which is the National Reentry Resource Center, or NRRC for short. So your planning and implementation guide must be completed in coordination along with the technical assistance provider, and then very importantly also needs to receive final approval by BJA. Grantee teams will have 12 months to complete the planning and implementation guide, but our goal as your TA provider is to work with you to complete the guide even in less than 12 months if that's feasible, so that we can help you shift into the implementation phase as soon as reasonably possible. So there are different sorts of allowable uses of your award funds during this planning phase, which is the initial phase you'll be in your grant project. And you can see here a number of examples just to give some highlights of these allowable uses, and they would include things like all of your planning meetings, your advisory group, your stakeholder meetings, all of your planning around the screening and assessment processes you'll use, your case management protocols, your information sharing protocols, all of the planning and consideration you do around which evidence-based practices you're going to use in your grant program and implement in your grant program to address criminogenic risk, mental illness, and substance abuse. Allowable uses during planning of your award funds also includes really your decision-making and planning on which recovery support service options you're going to consider and use for your grant program, and also, of course, all your planning around your data collection, performance measurement, and evaluation plans. Once the planning phase is formally completed and BJA shifts the grant teams into the implementation phase, then there are different allowable uses of your award funds that are allowed during implementation. And again, you can see some common examples of these allowable uses. These would include actually the implementation of all the things that you've previously planned. So continuing on with your leadership engagement, around advisement for the program, but also to consider sustainability options. All of the screening and assessment practices that your program will employ, all of your collaborative comprehensive case planning that you're going to be doing on an ongoing basis, both in the facility and in the community with your participants, all of your information sharing, your recovery support services, and really the implementation of all the evidence-based practices that you plan to use in your program, and also the ongoing data collection, performance measurement, and evaluation processes. So just some examples for you to take a look at. And now I'm going to turn it over to my colleague Sarah Wurtzberg, who's going to speak with you further about the Planning and Implementation Guide and the technical assistance process. Sarah?
Great, thanks so much, Allison, and I'd like to add my congratulations to everyone. We're really excited to be working with 13 new jurisdictions across the country. And this is really our favorite time of year when we get to learn more about the new programs, the great ideas you all have, and how we can really get started to help you plan and implement your program. So welcome. So there's a couple of ways in which we are going to be doing training and technical assistance with you. Really, our goals are to connect you with subject matter experts, both in our organization and other people across the country, to recommend publications, online resources, webinars that will help with the various components of planning and implementation, and also to host peer learning communities. To that end, you'll, as we mentioned, have a TA provider, Mark or Allison, who will help guide you through the process and is really meant to be a strengths-based coach for you to talk you through all of the elements of the grant and to help connect you with other sites around the country. We also have the resources and tools available through the National Reentry Resource Center website, and we'll set up different peer learning options for you to work with the entire cohort. So this is really done through monthly calls with your training and technical assistance provider. They'll work with you at the beginning of your grant program to complete the planning and implementation guide exercises. And that will be a big focus of your technical assistance calls, as well as answering other questions that you need. We also will then connect you with resources. So if you're filling out screening section and you need help selecting a mental health screening instrument, then we're able to provide you some documents and connect you with ourselves and with other experts who can talk you through that process. We'll also host webinars, which is the peer learning component that we mentioned, on specific topics that are of interest, so you can engage with other sites, past sites as well as current sites, and really learn more about best practices. Then for some of the grantees, we're able to do an on-site visit, and the focus of these visits will be really tailored to the needs of the jurisdiction. Some examples of what technical assistance looks like. So part of the technical assistance is really working through the different stages of the planning process. You can see a lot of that reflected on these examples. Things like helping to think through who should be in your reentry task force, or the body that's going to oversee the grant, and what we can help facilitate different strategic planning sessions or meetings of that, or even if you're just wondering who should I be bringing around the table to discuss this. We also work to assist with data collection and analysis. So we know that when you get a new federal award, often there's a whole bunch of new measures that you have to collect. So we can help talk through that, connect you with other sites, think through the best options for how you can tell the story of your program. And that's a big piece of this as well. We really want to help you promote your work and to be able to talk about it through using data, but also using the experience of your participants and the team who's working with the participants. We also can provide training on various topics like recidivism reduction, criminogenic risk factors, and other topics related to mental illness and substance abuse as well. Additionally, we really view ourselves as a translational body. We like to translate research and think about how to bring it into practice. So if you read something and this is, the standard to help address criminogenic risk needs, how do you actually put that in practice in your jurisdiction to help people who are in your correctional facility? The other big piece is supporting the development of your implementation plans and your sustainability plans. So when you move from planning to implementation, you've got a good foundation, but as you get started in implementation, of course, additional challenges will always come up. We really want to make sure that everyone has a plan to sustain these grant programs, because you're going to put 36 months or 3 years into it. We want to make sure that some, if not all of the work can continue after the life of the grant. So I'm going to talk about the planning phase in terms of our training and technical assistance. So during this phase, you'll actually be working with your TA provider on completing the exercises as we've discussed. But really the big piece of this is just to make sure that you're open with them and you're honest and accurate. So if you do have questions, we can actually be a resource for you in troubleshooting some of the issues based upon our experience working with sites, as well as our experience with the other grantees in your cohort. So really they're meant to have brief answers, but it's supposed to be a helpful process for you to really understand what the goals are of your program and how you can set yourself up so that way day one of implementation you are ready to go and everybody's confident in what you're doing. So you'll be filling out the different exercises for the monthly calls, and you'll talk to the TA providers about your completion, and they'll help you get it to the point where the guide is actually ready to submit to the Bureau of Justice Assistance. And through that submission process and approval process, you would then be able to move to the implementation phase. So the P&I Guide is used to designate that planning versus implementation phase, but it's really also meant to identify different things and trends we see. So who's doing well, the challenges that come up across different sites. If a lot of different sites are really having a challenge on having case conferencing procedures in place, for example, we would then know that as a cohort, it'd be great to do a peer learning activity to really help you talk through those challenges. So a lot of it is also to be able to help facilitate some of that learning across the cohort and to bring in people from past cohorts who could be helpful. Also, over the course of the planning guide, the TA provider will be looking for things that they can help you with or work with you on, and that will really lead to a technical assistance plan following the planning phase. Additionally, this will enable best practices and ideas to be exchanged, so as you start learning, you can share your ideas with other sites. And then the Bureau of Justice Assistance also uses this to better understand your program. So the sections of the P&I Guide are as follows. The first section is really just some basic information for you to provide any information on if anything has changed as well in your grant program and to identify what your overall goals are. Section 2 is focused on who you're actually going to be serving. So how are you going to identify who you're serving through this grant? So this time, because there have been some changes to make this grant more system-focused, we're looking for standardized screening throughout the correctional facility. And if you're not already doing that, that can be something that's a huge lift. So that would be a big focus of talking about how you think you can get to that point. Section 3 is focused on identifying the evidence-based practices and support services. So what will be done to address the criminogenic risk and need factors, mental illness, and the substance use disorder, and then are there other support services like housing or other recovery support services available. Section 4 is based upon the collaborative comprehensive case plan and post-release support. So what does that reentry plan look like? How is it combining all the information? Who do you get together to talk about that information? And it goes through our web-based tool that Mark spoke about earlier. In Section 5, we talk about data collection, performance measurement, and program evaluation. So this is meant to help you think through how you're defining successful completion, what measures you're actually collecting, and other things that are important to being able to plan so when you get to implementation, you know what to collect in order to show that your program is doing the great work that we know it will be doing. Then Section 6 is focused on sustainability and trying to make it actionable. So what can you do to help sustain the program? Are there folks that you should be talking about at the local level or state level or tribal council that can be helpful to sustaining? Then the last piece is an appendix that has supporting resources. So that's webinars, it's research, it's documents that you can read through if you have questions on any of the sections. There's a corresponding resource, but your TA provider will also help provide those additional resources. So I'm going to turn it back over to Mark.
Great, thanks, Sarah. So now we have time for some questions and answers, and I'll remind folks, if you have a question, feel free to chat it into the chat box in the lower right-hand portion of your screen. So one of the questions that we have is, will this webinar be recorded? And yes, we are recording this webinar, and we hope to have it posted by tomorrow or early next week, and we can follow up with you once the posting is available. And another question we have is, can I finish the planning and implementation guide sooner than 1 year? Sarah, do you want to take this one?
Sure, absolutely. We will work with you to try to set a good timeline for you, and the TA provider supports you. I think we're certainly happy to work with you to try to complete it. We'll set out a timeline for all the grantees that will be a little bit under the year, but if you have a specific time frame that you're trying to meet, we'll certainly work with you to meet that time frame, and grantees in the past have finished it in under a year as well.
Great. And another question we have is, when will the planning and implementation guide be available?
Thanks so much for asking that. That's such a great question. So your TA provider has been working to set up the introduction calls to you and to really start getting to know the team. And our expectation is that the P&I Guide will be available in the next few weeks. So generally, hopefully by your first call.
Thanks, Sarah. Another question we have is, when will I hear whether my budget has been approved? Andre, do you want to take this one?
Thank you, Mark. You will not hear that your budget has been approved until you meet the mandates that have been identified in your special conditions. That takes time. We're not just working on your grant. We're working on several other grants, Second Chance Act, as well as other funding streams. Therefore, I request all of your patience as we work through what we know can be a bureaucratic process.
Thank you, Andre. And again, I'll just give it a few minutes in case folks have questions to type it into the chat box. And another question we have is, who should be on the first calls for the grant? Sarah, do you want to take this one?
Sure, absolutely. That is a great question. So since these partnerships are really cross-sectional, it would be great if someone from the correctional institution would be on the line, and then other key partners related to behavioral health in the community. If there is community supervision, that's a part of the grant program, that would be a great partner. But part of it just depends on how your grant project is set up. So if you have any folks who signed an MOU or wrote a letter of support in the for your grant application, those would definitely be people who you should consider to be on the first call. And the TA provider will work with you to discuss how you would like to communicate moving forward, if you have a main grant point of contact, or whether you want them to be communicating with the whole group. So some of that is just, we will figure it out on the first call as we get to know you a little bit better. Also, if there's a research and evaluation partner that's already in place, they would be a great person to join the call too.
Thanks, Sarah. Another question we have is, what different measures are in the performance measurement tool? And here I'll make a plug for the performance measurement tool PMT webinar on November 21st from 1 to 2 p.m. Eastern Time. And then Sarah, do you want to talk a little bit more about the measurement tool?
Sure. So the performance measurement tool just asks for some basic information about your grant program. It'll ask questions about, for example, your criminogenic risk and need assessment. It'll ask questions about how many people are enrolled in your program, how many people complete your program, and some questions about sustainability as well. So there's really a variety of different things that it covers, and I really encourage you to tune into the PMT measure to learn a little bit more about that. I think the webinar will be super helpful, but we'll also walk you through that as we talk through the data collection section.
Thanks, Sarah. And as a follow-up question to that, another question we have is, what are some of the typical outcome measures that grantees track in this grant program?
That's a great question. And, you know, there is variety to that depending on which entity, but, you know, recidivism reduction, of course, is a big key metric for any Department of Justice grant program. So we really like to talk through the nuance about how you collect that and the amount of time you collect it for and whether there's a standard in your jurisdiction. When it relates to the programming, a lot of it can be iterative. So has someone actually been screened? Have they been assessed? So when we're talking at the systems level, if you're doing standardized screening, is every single person that moves into your correctional facility screened for mental illness and substance use disorder? Then out of those, what percentage of people actually get assessment? From those assessment, who is referred to treatment and who is able to actually receive programming pre-release while they're still in the correctional facility? So we would call that when they would initiate contact into the grant efforts, when they would actually engage in treatment or other support services, such as cognitive behavioral intervention, and then how long do they actually stay in treatment once they're in their community? What's their retention rate? So there's various measures that you can collect in the facility and then also as the person reenters. And when you're having those discussions on target population, part of that is scoping out how long you're also going to work with that person post-release. So, when are you actually having touch points to reassess someone, to reevaluate the case plan? Is it 90 days out? Is it 30 days out? Is it 60 days out? What does that actually look like?
Great, thank you, Sarah. And another question we have is, who should be included or who should be at the table for the advisory groups or stakeholder groups for the grant program?
Another great question. So that also includes the variety of people. So definitely someone from the correctional facility, a sheriff, or someone like that. Often judges and prosecutors would be included in that as key referral sources, people from community supervision agencies, so probation or parole, depending on what type of agency you work at. If you're working with a correctional institution, we also recommend a correctional health provider, and if there are other contractor providers who are providing mental illness or substance abuse services, they can be a key partner too, because they can really help with the referral process. When we're talking about reentry coalitions, we would also want those folks in the community that can be helpful. So are there education providers, vocational providers, housing providers who can work with you as people get stabilized, as they get treatment, and as they're ready to figure out the other pieces to improve their quality of life?
Great, thank you, Sarah. And another question we have is, can you describe a little bit more the requirement for standardized screening and assessment at the correctional facility? Sarah, do you want to take this one?
Sure. Yeah, so the goal of that is really to try to move the work to a systems level. So it's a really great opportunity that you'll actually know how many people have mental illness and substance abuse in your correctional facility. And that isn't common around the country. So we want to make sure that this group is starting to get that information so you can be leaders in this way to actually know how many people, what percentage of people have mental illness and substance abuse in your jurisdiction and also have co-occurring disorders. And then from there, it's really based upon the length of time someone will be in your facility, are you able to assess them? What does that assessment process look like for mental illness and substance use services? So this is a piece that we're certainly really excited about, because in the past that hasn't been a grant requirement, but this is really an opportunity for all of you to be leaders in this way and to really lead in systems change in your jurisdictions.
Thanks, Sarah. I'll give it a few more minutes in case folks want to enter questions into the chat box in the lower right-hand portion of your screen. All right, well, I want to move on just briefly to talk a little bit about some resources that we've listed here on the slide deck. And so we have links to a few resources here: the National Reentry Resource Center's webpage, the Collaborative Comprehensive Case Plans web tool that I talked about earlier on the webinar. We have process measures at the interface between justice and behavioral health systems, advancing practice and outcomes. And this could be helpful as you think through what do you want to include as some of the key measures of your grant program. And also we have a webinar on best practices for successful reentry for people with opioid addiction. This was a webinar that we hosted in July of this past year. And then just finally, I want to remind everyone to sign up for the National Reentry Resource Center's newsletter for information about upcoming webinars, resources available, and news in the field. And you can also sign up for our behavioral health newsletter, as well as other newsletters from the Justice Center. And again, this webinar is being recorded, and we hope to have it available by tomorrow or early next week. And I want to thank everyone for joining the webinar today. Thanks to Allison, Sarah, and Andre. And thank you to all of you as the grantees, and we're really excited to work with you for the next 36 months. Thanks, everyone. Have a great afternoon.